The process of childbirth in the ancient Egyptian times was influenced not only by medical knowledge, but also by religious beliefs and magical practices. It was seen as a deeply practical and highly spiritual experience. In this video, we will explore how pregnancy was interestingly detected during this time, look into birthing practices, medical knowledge, remedies, and also review how women were looked after postnatally. If you enjoy exploring how medicine was practiced during different times and in different cultures, please follow my channel, Doctor of the Ages. The Egyptians developed surprisingly insightful and sometimes even accurate methods for understanding reproductive health. One of the most fascinating examples comes from the Berlin Papyrus. This is one of the primary sources of ancient Egyptian mathematical and medical knowledge. Egyptian women would use the barley and emmer wheat urine test to detect pregnancy. It involved urinating on 2 bags of grain, one with barley and the other with emmer wheat. If either sprouted, it was interpreted as a sign of pregnancy. They thought barley sprouting indicated a male child and emmer a female child. Surprisingly, modern science has shown that this test can sometimes work due to the high estrogen levels in the pregnant woman's urine, which can stimulate seed germination. A study done in 1963 found that the urine of pregnant women promoted growth of the seed in 70% of cases, while urine from non-pregnant women and men didn't. Their sex prediction method, however, was less reliable and doesn't really have any scientific backing or support. Egyptian physicians also likely tracked missed periods, breast changes, and appetite shifts, though these were not formally recorded in much detail. Birthing was both dangerous and sacred in ancient Egypt, so birthing practices involved a mix of practical midwifery, magical protection, and ritual traditions. Egyptian women gave birth in a squatting or kneeling position on special birth bricks, which were clay bricks arranged to support the women. We now know that squatting during childbirth may offer benefits, such as wider pelvic opening, aiding in the baby's descent. It can also help with bearing down effectively and potentially reduce back pain. Some birth bricks were decorated with protective imagery like gods, magical animals, or hieroglyphs to safeguard the mother and child. A famous birth brick from Abydos depicts Taweret and Bes, gods thought to protect mothers and babies, and protective symbols like snakes or crocodiles, which were believed to ward off evil. Midwives or wise women were usually the ones that oversaw the birth. They were likely experienced women from the local community who passed knowledge through generations. Male doctors didn't typically attend births, as it was a female-only space due to modesty and ritual purity. Midwives would guide the mother through labour, use herbs, massage, and prayers or spells for pain relief and delivery. A midwife would support the woman from behind, helping her maintain balance and press downwards during contractions. They would also massage the lower back, guide the baby's head and shoulders during delivery, and encourage pushing at the right moments. They would generally have relied on tactile knowledge and experience passed down through generations to assess positioning, complications, or manage breech presentations. Herbs like frankincense and other foods like cumin, honey, dates, and even wine were used as pain relief, antiseptics, and to stimulate the uterus. The tools used at the time were simple but effective. They were often derived from everyday objects and natural materials. Clay or ceramic bowls were usually used to mix these remedies or hold massaging oils. Natural sponge and papyrus were used to absorb fluids, and linen cloths were usually used to clean the baby and mother after birth. They would often cut the umbilical cord with flint or bronze blades. No forceps or surgical tools have been found specifically for childbirth. So this suggests that if complications arose, the outcome would depend on natural methods or divine intervention. C-sections were only ever attempted post-maternal death. There was a lot of superstition and divine invocation around childbirth due to it being so high risk. The usual protective deities invoked included Taweret, the goddess who guided mothers, Bes, a dwarf god who scared away evil spirits, Isis and Hathor, goddesses of motherhood and love. Magic spells were usually recited and charms were often placed around the birth area. Small symbolic statues were sometimes placed nearby too. Midwives also had the role of spiritual guardians, so they would chant protective spells, use amulets, and burn incense or make offerings to the goddesses. After birth, both the mother and child underwent ritual cleansing, which was considered spiritually and physically necessary. Mothers were also isolated for a time to recover and avoid impurity, as women were considered temporarily ritually unclean after birth. Although this isn't a belief that modern understanding would support, I suppose there would be some benefits, such as infection prevention, time for wound healing and recovery, and also allow bonding time with the newborn without any household or communal duties. As we can probably imagine, stillbirths and maternal deaths were common during this time. Without surgical tools or modern antiseptics, midwives were limited to natural outcomes. If the baby was stuck or the labour was complicated, there was little midwives could do to aid delivery. Skeletal evidence from cemeteries shows that women often died in their reproductive years, and many graves include signs of women buried with infants, suggesting death during or shortly after childbirth. So as you can appreciate, childbirth was a very dangerous and risky event in ancient Egypt. Practices were very different to how they are today, and actually also vary when compared to other ancient civilizations. I hope you enjoyed this video and found it interesting as well as informative. If you did, please do like, share and follow my channel, Doctor of the Ages.